Good afternoon. I am going to talk something about Baptisia tinctoria. Now this Baptisia tinctoria is very commonly called as wild indigo. So the common name of Baptisia is wild indigo and it comes from Leguminaceae family. Now this remedy Baptisia is basically an acute remedy. It is suitable for most of the acute diseases, especially fever. This remedy Baptisia is a very short acting medicine and it is especially suitable for complaints that are not very long lasting, which means this remedy is suitable for acute complaints, for acute fevers. Now what do we understand when we say acute disease? Now acute diseases are those which come on suddenly. They are of very recent origin. Just one day or 2 days ago he was well and today he is suffering from fever. Now this is an acute disease. It comes suddenly, comes very violently, stays for some time, and then either it gets well, the patient gets well, or he suffers and it goes into a chronic state. So this person who needs Baptisia will be in acute trouble, especially acute fevers. Now this fever can be of any type. This fever can be due to zymosis. This fever could be a scarlet fever. This fever could be a diphtheric fever. This fever could be a typhoid fever or due to some kind of gangrene. So basically it is a remedy for fever which has septic origin. Now this is a fever of infectious origin, and what is characteristic about Baptisia is that usually fevers take a considerable time to appear and progress into a pathology. But when it comes to Baptisia, it brings on the septic state more rapidly than most other remedies. So the speed of disease is very fast. The other remedies in comparison to Baptisia will have a slow and gradual progress. The pace of disease in Baptisia is fast, and in other diseases, other remedies, the pace is comparatively very slow. Usually a septic state will take 4 days, 5 days or 1 week to get developed, but in Baptisia, since the pace is very fast, the symptoms will come in either few hours or in few days, but the pace will be very fast. The fever develops and it goes into a state of sepsis. Now any kind of fever, let it be a malarial fever, let it be a typhoid fever, let it be a fever due to gangrene, let it be a fever due to diphtheria, let it be a scarlet fever, any kind of fever, when the pace is fast, when the pace of disease is fast, is rapid, Baptisia should be thought of. And the rapidity is the symptoms appear and very soon it goes into a state of sepsis. So Baptisia is a remedy for septic state of fevers, for fevers due to sepsis. Now sepsis means a kind of toxins that is produced by bacteria, large number of toxins that is getting circulated in the blood. So this Baptisia is indicated in all such kinds of fever where there is large amount of toxins in the blood. It is a state of sepsis. The fever comes suddenly, he goes down very suddenly and he is prostrated, he is very weak, he feels stupid, Now suppose if you try to talk a person who has got this sepsis fever, if he needs baptisia, he will be in a state of delirium. Now what kind of delirium it is? If you try to talk to him, you will feel as if he is drunk. The patient, because of the high fever, because of the sepsis, he does not know what he is talking about. He is in confusion. Usually it will be very difficult for you to arouse him and talk to him, but once aroused, he will speak anything that he does not know what he is talking about. And very soon he will again go into a state of stupor. He will again lie down and he will sleep. He will go into a state of semi-consciousness. Another characteristic which calls for baptisia is the offensiveness. The offensiveness of the discharges. All of the discharges are putrid. Be it the sweat of the patient, be it the urine of the patient, be it the saliva of the patient, be it the stool of the patient, let it be any discharge from the body. All kinds of discharges are putrid and they are very offensive. The odor is simply cadaverous, pungent and penetrating. Now what do we understand by cadaverous odor? By cadaverous we mean the smell is like that of something that is getting decomposed, like a human meat or human muscle or human tissue is getting decomposed. It is that kind of smell. Now it is called as cadaverous odor because the smell is of that kind. It feels as if some dead body is getting decomposed, and if you can imagine that smell, now how does it feel? It is very pungent, it is very penetrating. Now let it be any discharge, let it be his perspiration, let it be his stool, let it be his saliva, any kind of discharges that comes from the body of the baptisia patient is very offensive. Now the odor of the discharges is so penetrating that on going into the front door, the whole house, if the room is open, is filled with the odor. Now it is so penetrating that you cannot remove your attention from the odor of the smell, odor of the discharges. Now we talked about the delirium of baptisia. During delirium, this very striking things comes up is he feels as if his body is scattered, as if there are two persons lying in the same bed. He seems to feel that there are two of him. He realizes a dual existence whenever he is roused up. Whenever you try to wake him up from the stupor, from the semi-consciousness, he will be seen trying to get the pieces together. He will try to collect all his parts that he feels are scattered, and by looking at him, you will feel as if he is confused, as if intoxicated. So such is the kind of delirium. Now the offensiveness of baptisia is so marked that even the breath that is exhaled is also very offensive. The delirium is such that patient falls asleep even before he can answer a question in the midst of his answer, and whenever you try to wake him up, he will try to collect all the scattered parts. He feels as if all the parts of him are scattered around his bed, or he feels as if there are 2 or 3 persons lying in the same bed. So he will be trying to collect all of them. So you feel as if he is drunk. When you see him, you feel as if he is drunk and he is intoxicated due to getting drunk. Now this remedy is very inappropriately used as a very specific remedy for typhoid state, for typhoid fevers. However, It is not only the typhoid fever, it can be indicated in any kind of fevers, any types of fever, provided the symptoms agree. Like all other fevers, like any other fever, the patient feels sore and bruised, especially on the parts that are rested upon. The patient is predominantly chilly and predominantly a left-sided remedy.